our YouTube and Instagram live. Welcome you all. And to start with, a very happy Diwali to everybody. I hope you celebrate this festival with light and distribute sweets. So let us start our session again. I hope you can hear me properly and we can start it. I know today is Diwali time and still taking a YouTube live and an Instagram live. I hope people join in early so that we can start. Yeah, welcome, Dr. Kaushri. So, I hope you had, Misha Kundwani, welcome. I hope you last time understood what I wanted to tell you about the YouTube live and Instagram live. I'd asked you a question. No, I think I asked the question on the lecture series of November which I'm doing. I showed a case of wrist drop. I think sorry. Yeah, welcome, Dr. Mohit. So before you start, I'll just deal one of the cases which I just had treated with very good results in relation to the taste, or you can say in relation to smell. In fact, there was a case, and that case had a problem that his smell was diminished. He always tell that after Corona, my smell is not so as it was before, and he was very upset. He had taken a lot of medicine. Doctor said nothing is there. It's more of psychological problem. You just go and be normal, and the smell will come back again. But he had smell which was very much diminished. He could not smell uh, anything which he used to do it before Corona. We also gave some medicines to him, and it was not as much as improvement as he thought, and we thought also. One or two things which are very interesting in that case, and we took the whole case and we got a few symptoms which were very important in that case, and that was he always felt after Corona weeping, weeping, and it was very surprising for him also. He just suddenly started weeping, and with a trivial cause also he started weeping too much. Yeah, welcome, Dr. Vishaka. And he became very emotionally vulnerable after that. It was a very important symptom because the patient was not like that before. So any guesses which remedy, which what we thought, what we thought at the in that instance? Anybody? It was a very interesting case, and the patient was really fed up with that. These few symptoms which I thought were very important in that case. So what do you feel? What remedy that comes to your mind? Anybody? He after Corona, he became very emotionally vulnerable. Started weeping hysterically without any cause sometimes, and if there was a trivial cause also, he started weeping, and the smell was also diminished. So can anybody guess the remedy? Of course, we failed 2 or 3 times in that case, and then after that remedy, he said that I'm now having the same smell, having the same mental agility and the same mental vigor and the same smell which I had before Corona. And to my surprise, the remedy was very different, which we thought about. I prescribed him a dose of Hyosamus 200, Hyosamus 200, and Hyosamus 200, cured that case. Of course, there are other symptoms of Hyosamus, but these were the only symptoms which I took for prescription. This is one of the very important, case which I wanted to share with you. Exactly opposite, I had a case where the patient says that his taste has increased so much, that simple taste of salt, simple taste of sweet, simple taste of other food used to taste more than what it was. Means sweet used to taste more than it was sweeter than other for others, and used to always tell at home, put less, less what you call sweet, less sugar, because I feel it more. And this was again after Corona. So a very interesting thing where whether taste had become acute, taste had become acute. In this case also, we tried. I had given 2 or 3 medicines. The patient was somewhat better, but not so much cured. And then in that case, with few symptomatic, we give that patient coffea cruda. Coffea cruda, 200, 2 doses, and it cured the case. Just I wanted to share these two cases because just last 3-4 days the patient had come, and that's why I wanted to share this case. So it is very important in homeopathy, as I always say, sometimes if you are very prejudiced, you basically think only those remedy which you have learned and which has been taught to you before without giving importance to other remedies. That's why I always tell you, read aphorism number 6 every day so that you understand the meaning of unprejudiced observer, not even in case taking but also in prescribing the remedies also. In fact, if you have read coffea cruda, there is one symptom in relation to taste that everybody should remember, that is पेशेंट आके बोलता है कि मुझे जो ये रहती ना बादाम, कभी कभी वो भी बहुत कड़वी लगती है. समटाइम्स ओके, सम आलमंड्स आर बिटर, बट ये वो बोलता है कि कुछ दिन ऐसी रहती है मुझे हर बादाम कड़वी लगती है. And in that case, I had a beautiful case of migraine, which was better but not totally cured. But at a passing symptom, the patient told me this symptom, and with this symptom, I gave the patient coffea cruda 1 ml single dose that cured the case. So that's why I always tell that's why we have started the lecture series. If you have joined my lecture series, I had shown a case of complete wrist drop. The whole radial artery had a problem. The whole wrist drop was there. With homeopathy medicine, we could not treat, we could cure that case. With simple case taking, simple remedy, what you see in your case taking, prescribe that. That is important. So we also I shared that case in my lecture series of November. I think this 2 days before, only Thursday. In the classes also, I teach them be an unprejudiced observer, not for case taking, but also for prescribing your remedy. That is very important. Otherwise you have the same habit of prescribing the same remedy every time because you have learned that in Sora. So welcome, Dr. Abha. So if there is no other question, we can always have other cases in my clinic so that I am able to share my experience. Now there was a case where the patient always told, whenever he's coughing, I hope there are no questions and I have not missed any questions. Yeah. I think it's Diwali time, so you have eaten a lot of sweets. The mind also has become weak. That's why questions flow is slow, I think. And an interesting case now, there is a season of cough and cold, and there was a case where the patient said that whenever I start coughing, मेरे मुंह में मतलब एक ब्लड के समान टेस्ट आता है. मेरे मुंह में ब्लड के समान टेस्ट आता है. Means bloody taste on coughing. Welcome, Dr. Vasim. So of course, whenever these are the symptoms, so my assistant had given him the patient phosphorus and did not work with that. So, hi Dr. Vasim. So whenever there is bloody taste in the mouth on or when coughing, 2 or 3 remedies very, very important, and I prescribed that patient Rustox. And to my surprise, when I went in the mathematics of Rustox, when the repertory, Rustox is given in 3 marking, bloody taste in mouth when coughing. See, and Rustox we have used for maybe skin or winter aggravation or rainy season aggravation, it is there. But see the symptom. Otherwise, we always think that hemorrhagic remedy, bloody taste in the mouth while coughing, and we never think about Rustox. We never think about simple belladonna also, and that's why it is very, very important to understand and prescribe depending on your patient's symptoms. Don't be prejudiced. That is the takeaway point today, because last lecture of wrist drop when I did in 2 days back, I had a lot of questions on WhatsApp, lot of question on my WhatsApp also, and they were asking, sir, good case, good remedy, but how did you go to that remedy? I have dealt with that remedy very precisely with differentiating that picture of the remedy with other remedies. So it is very important for us to understand that our case taking and rubrication should be absolutely free from all the so-called notions which we carry of the remedy. Okay. Now we have a case. Okay, sir, please suggest some medicines for treatment of mumps, painful and feverish. Whenever if you get acute disease and whenever you are talking about mumps, what is the age of the patient? What is the age of the patient? Okay, and see, whenever there is mumps, two or three things you have to very think very precisely. The patient is suffering from mumps, it is very painful and it is feverish. That means there is inflammation. So whenever there is inflammation, there is pain. You have to think about two, three remedies that immediately should come to your mind. Of course, symptoms basically very important. First, you must think about belladonna. Second, you must think about lachesis. Third, think about phytolacca. Fourth, think about Merxol. And fifth, think about Rustox. So these five remedies are basically most important which I've seen in my practice. So differentiate from these remedies and you must get the result. I'll just share one of my cases. I had a very interesting case of orchitis. And we took the case, we gave the remedy, patient was better but not cured. On asking them, we came to know that the patient suffered from mumps few months back and now he suffered from orchitis. And which is that remedy? We prescribe the patient a single dose of Pulsatilla 200. Orchitis after mumps, metastasis from mumps to the testes, and Pulsatilla 200 cured the case. I just got because Dr. Vishaka put Pulsatilla and you put the case of mumps. So I just recalled that case. That simple, what you can't say mistake of case taking, that simple part of case taking not done by us or not told by the patient, or we were not careful in asking. That's why we could not get that remedy Pulsatilla. So metastasis in the testes or orchitis after mumps, think about Pulsatilla. Very important remedy. Okay. As you go further, okay, 4 years you can do this remedy. There are viral in age group 4 years to 20 years also. Yes, very nice. And these are the remedies you should think about. Of course, if it is not mumps and the symptoms are similar, then you can think of these remedies also. There's no problem about it. Can you think further? Can you have questions, or we can always have other cases from my cases? Okay, if there are no questions, I hope Dr. Vasim, I have answered your question, and there are no questions on YouTube also. So I was just on the other day taking a lecture on anger, anger mater medica in my clinic. I have few doctors who are with me, who are helping me in my practice. So I was just telling them something about anger. Anger is such an emotion where everybody passes through this stage sometime or the other. And whenever anger comes, there are so many remedies in a mater medica. I was just discussing that the case where of course, everybody knows one rubric, angry when obliged to answer, and we have a lot of remedies. But have you ever seen a case where the anger is causeless? When the anger is causeless, and I never imagined, in that case, after failing in one or two of my prescription, I prescribed the patient carcinosin, and the patient came out with that remedy. We never think of carcinosin where the anger is causeless, because we have seen carcinosin plant, elements from carcinosin patient, elements from dominance, very social, very precocious, very yielding, love for nature, love for gardening, love for traveling, very romantic, and this is carcinosin. But anger causeless, to my surprise, carcinosin was given and that cured the case. So that is one part where I was taking anger. Other anger remedies, welcome Dr. Anwar. Other camphor. Now anger from cough. इतना खांसता है पेशेंट को तो गुस्सा आता है because of खांसी. Anger from cough. You must think about Staphylococcus and spongia. Everybody knows what is spongia, but sometimes in dry cough, it is very difficult to differentiate spongia, drosera, rumex, mephitis. So in spongia, anger from cough. Very important. If your patient has that, give spongia. There is a very interesting rubric: anger very easily, angered very easily. And again, we have remedies, anger, easy anger. We have chamomilla, we have naxomica, we have lycopodium, phosphorus, platina, dulcamar, crotalus, cocculus. So anger from least contradiction. मतलब पेशेंट को किसी ने नहीं बोला या पेशेंट की बात आपने काटी तो उसको गुस्सा आना शुरू हो जाएगा. Now, if you have seen your Mathematica, if you've seen your rubric, if you have seen your repertory, there is one remedy which I have seen in lot many of cases. Before I was not very sure whether the remedy would work, but then when I took this symptom and rubric, it worked beautifully. So anger from least contradiction. Remember one remedy, write down in your Mathematica. It is Nicolum carbonicum. Nicolum carbonicum is a very, very important remedy when there is anger from least contradiction. You have lot of remedies: anger from contradiction, anger from interruption. For instance, if you have seen anger from contradiction, here Nicolum is not mentioned. Here Nicolum is not mentioned. In Nicolum it is mentioned anger from least contradiction. So in general, if you are taking anger from contradiction, you can think sepia, ignitia, lycopodium. Okay, Nicolum is also given. I think it is in 2 mark. So Nicolum is there. Ferrum metallicum, sepia, aurum metallicum. These remedies also there from anger contradiction from. But anger from least contradiction, think about Nicolum carbonicum. Very, very important remedies. And because of anger the face becomes livid, और बिकॉज ऑफ एंगर द फेस बिकम्स, बोलते हैं ना गुस्से में चेहरा लाल हो जाता है. विच रेमेडी कम्स टू योर माइंड अपार्ट फ्रॉम बेलेडोना? एनीबडी? हिंदी में बोलूं? ओके. इसलिए इंग्लिश हिंदी बोल रहा हूं कि बहुत कुछ डॉक्टर्स इंडिया के बाहर के भी है, कुछ डॉक्टर्स को इंडिया के अंदर भी इंग्लिश का थोड़ा प्रॉब्लम, मैं दोनों मिला के बोलूंगा. सो कभी कभी बोलते हैं ना कि गुस्से में चेहरा लाल हो जाता है, गुस्से में चेहरा लाल हो जाता है. कौन सी रेमेडी अपने दिमाग में आती है? एक तो बेलेडोना है, वो मुझे मत बोलिए. और कोई रेमेडी? गुस्से में अगर चेहरा लाल हो जाता है, इफ इन एंगर द फेस बिकम्स रेड, यू मस्ट थिंक अबाउट बेलेडोना, चामोमिला, नक्सोमिका. वेरी वेरी इंपॉर्टेंट. एंड वन मोर रेमेडी, यू बी सरप्राइज, इट इज देयर इन दैट रेमेडी, दैट इज पल्सिटिला. यस, स्टेफिस एग्रेस डॉक्टर स्टेफिस उसके अंदर है, बट उसके अंदर बेलेडोना, चामोमिला, नक्सोमिका तो है, बट पल्सिटिला भी है. अभी पेशेंट ने बोल दिया कि मुझे बहुत गुस्सा आता है और मेरे गुस्सा हमेशा नाक पे रहता है. द एंगर इज ऑलवेज ऑन द नोज एंड बिकॉज ऑफ एंगर माई नोज बिकम्स रेड. आपने बहुत पेशेंट देखे होंगे, मतलब पेशेंट सेज बिकॉज ऑफ एंगर माई नोज बिकम्स रेड. कौन सा रेमेडी आपके दिमाग में आती है? एनीबडी? कौन सी रेमेडी आपके दिमाग में आती है? सोचिए. बिकॉज ऑफ एंगर द फेस the nose becomes red. Naxomica? No. Naxomica, the whole face would become red. Very, very important remedy. That remedy normally we have learned in our college days for hair fall. But a very important remedy when the tip of the nose becomes red because of anger. No, we are Dr. Sangma, we are talking about the nose, not about the tongue. And in anger, it does not have triangular red tip. It is a normal symptom of restox having triangular red tip. But I am talking about anger. गुस्से में नाक लाल हो जाती है, स्पेशली नोज का टिप लाल हो जाता है. नेट्रम्यूर नहीं. नेट्रम्यूर का फेस बहुत लिविड हो जाता है गुस्से में, बहुत लिविड हो जाता है गुस्से में. और कुछ इसके अलावा? अगर आप फीवर के अंदर गए और फीवर में पेशेंट का फेस लाल हो दिखता है, वो भी एक रेमेडी हमारे दिमाग में आ रही है. कैलकेरेक आपका चेहरा लाल नहीं होता है. कैलकेरेक आपका चेहरा लाल होता है, बट टिप ऑफ द नोज लाल नहीं होती. अगर गुस्से में, अगर फीवर में पेशेंट का चेहरा लाल हो जाता है, डोंट टेल मी बेलोडोना. और कोई रेमेडी आपके दिमाग में आती है? अगर फीवर के दौरान, अगर इन फीवर पेशेंट्स का फेस लाल हो जाता है, think about हिप्पोमैनिस, दैट इज हॉर्स मिकोनियम. फीवर के ड्यूरिंग अगर चेहरा लाल हो जाता है, बट गुस्से में टिप ऑफ द नोज अगर लाल हो जाती है, दोस्तों सोचिए विंका माइनर एक दवाई है जिसमें लिखा है कि पेशेंट का टिप ऑफ द नोज लाल हो जाता है गुस्से में. सो आई वाज जस्ट टीचिंग एंगर टू माय स्टूडेंट्स. कोई पेशेंट क्या बोलता है? एंगर बिकॉज ऑफ जेलेसी. देन यू हैव टू थिंक अबाउट, मतलब किसी के प्रति अपने को बहुत जेलेसी और गुस्सा आ गया है, तो जेलेसी की वजह से गुस्सा आना है, एक तो है लैकसिस, दूसरी रेमेडी कौन सी है? द सेकेंड रेमेडी, एनीबडी? एंगर विथ जेलेसी. फर्स्ट इज लैकसिस, सेकेंड थिंक अबाउट हाइपोथैलेमस. आप अपने क्वेश्चंस भी पूछिए, यू स्टार्ट आस्किंग क्वेश्चंस, बिकॉज मैं अगर मैथमेटिक्स का पढ़ाता रहूंगा तो आधा घंटा वैसे निकल जाएगा. दूसरा रेमेडी है, नो लाइकोपोडियम नहीं है, जेलिसी की वजह से अगर एंगर है, इफ इट इज एंगर बिकॉज ऑफ जेलिसी, देन द रेमेडी इज वेरी नाइस, हाइपोथैलेमस. वेरी नाइस. सो अगर आपको अच्छा लगता है तो मेरे को जरा थम थम मिलना चाहिए और 100% मिलना चाहिए और अच्छे हार्ट्स मिलना चाहिए, तो मेरे को भी बड़ा मजा आता पढ़ाने में. ओके, आगे जाएंगे. जो भी मैंने एंगर में पढ़ाया उस दिन, एंगर आफ्टर मेंटल एक्सर्शन. पेशेंट ने बहुत दिमाग का काम किया, बहुत पढ़ाई किया, बहुत लोगों को समझाया, बहुत ये किया है, और गुस्से में, एंगर आफ्टर मेंटल एक्सर्शन, विच रेमेडी कम्स टू योर माइंड? एंगर आफ्टर मेंटल एक्सर्शन, प्लीज थिंक अबाउट कैलकेरिया सिलिकेटा. Please think about Calcarea silicata. I'm telling you remedies and this because these are something which basically, leaves a mark in the patient's face, in the body, in this temperament. That is very important. कभी कभी हमको पेशेंट आके बोलते हैं, एवरीबडी लिसन टू दिस, कि इतना गुस्सा आया, आई वॉज सो एंग्री, आई कुड नॉट डू एनीथिंग, आई कुड नॉट थिंक एनीथिंग, आई कुड नॉट डू एनीथिंग. मतलब इतना गुस्सा है कि मेरी सोच पूरी जीरो हो गई, मैं कुछ काम ही नहीं कर सकता था, मैं कुछ सोच ही नहीं पा रहा हूं. विच रेमेडी कम्स टू योर माइंड? एनीबडी? एनीबडी? हम पहले कंप्लीट कर लेते हैं, उसके बाद आपको आंसर दूंगा मैं. सो एंगर की वजह से मैं कुछ सोच ही नहीं पा रहा हूं. बिकॉज ऑफ एंगर आई कुड नॉट डू एनीथिंग इन लाइफ. फर्स्ट ऑफ ऑल, विच रूब्रिक विल यू टेक फॉर प्रिस्क्रिप्शन? दैट इज वेरी इंपॉर्टेंट. और आप, ये सिफिलिटिक सिम्टम है, बहुत बहुत इंपॉर्टेंट है. व्हाट डू यू थिंक अबाउट? कि इन एंगर आई कैन नॉट थिंक, आई कैन नॉट डू एनीथिंग, आई जस्ट गेट एब्सोल्युटली नम. क्या रेमेडी सोचते हैं हम उसके लिए? एनीबडी? आज मैं आपको पूछता हूं. एनीबडी? बिफोर दैट आई टेक वन क्वेश्चन. एंगर, सर एंगर की वजह से सिम्टम एग्रेवेट होते हैं. फर्स्ट ऑफ ऑल, इतने बेसिक सिम्टम कभी कभी रहता है, एंगर की वजह से सिम्टम एग्रेवेट हो सकते हैं. बट कोई पेशेंट बोलता है छोटी बात पे मेरे को गुस्सा आ जाता है, गुस्से की वजह से. 3 रेमेडी आपको सोचना बहुत जरूरी है: फॉस्फोरस, काली म्यूर, सीपिया, ट्यूबरकुलिनम. अब हम आते हैं हमारे क्वेश्चन पे. इतना ज़्यादा गुस्सा कि मैं सोच मेरी हैम्पर हो जाती, मैं कुछ सोच ही नहीं सकता. एक बहुत इंपॉर्टेंट रूब्रिक है, लिख लीजिए मेरे के पास. आई हैव गॉट लॉट ऑफ रिजल्ट्स व्हाइल यूजिंग दिस रूब्रिक. एंगर फेल्ट एज इफ ही इज पैरालाइज्ड. एंगर फेल्ट एज इफ ही इज पैरालाइज्ड. One remedy you must remember in this case, and that is sister scan. Sister scan is a patient where he feels because of anger he is paralyzed, he cannot do anything, he cannot think anything. Sister scan and calcarea phos. The rubric which I am talking about is anger, he feels as if it is he is paralyzed. Are you getting me? Have you understood what we discussed in length about the anger and differentiation? But just we had a mathematical chat with my offline students. So anger, सिरवी, स्टेफी बोल रहे हैं आप, डॉक्टर संगमा. So sister scan and calcarea first. So we just finished it anger part. You can always ask me a question, because if I keep answering you, the half an hour will pass. So I did not understand your question, Dr. Sangma Paulsam. You have to answer yes. So वीडियो लाइव समाप्त होने के बाद यूट्यूब पर अपलोड हो जाएगा क्या? आई थिंक हो जाएगा. आई विल आस्क माई. बट यूट्यूब पे अपलोड हो जाता है. अगर आप पहली बार आ रहे हैं तो मेरे बहुत सारे वीडियोस अपलोडेड है, आप उस पर देखिए, एंड अपलोड हो जाता है, नो प्रॉब्लम. सेकेंड, कभी कभी क्या पेशेंट उठता है और बोलता है ना कि द पेशेंट गेट्स अप इन द मॉर्निंग एंड बोलता है, डॉक्टर साहब मैं आई गेट इन द मॉर्निंग, आई एम सो एंग्री, सबको पहले झाप देता हूँ, सबको पहले डांट देता हूँ, स्कोल्ड एवरीबडी एंड आई फील हैप्पी। मतलब बेड पे से उठा नहीं पेशेंट और गुस्सा चालू। मैंने आंख खोली, मेरे बेड पर गुस्सा चालू। थिंक अबाउट 3-4 रेमेडीज विच आर वेरी वेरी इंपॉर्टेंट। या sir, even if patient is not chilly, can you? Yes, still yes, sisters can, because see, it is anger felt paralyzed मतलब साइकोसिफिलिटिक मैजम हो गया। सो वहां पे आप थर्मल्स को बाईपास कर सकते हैं, सिस्टर्स कैन दे सकते हैं। इफ समवन सेज मेरे को गुस्सा आता है नहीं, सर गुस्सा आता है नहीं मतलब नहीं आता है, व्हाट्स द रूब्रिक? अगर आपको पेशेंट बोलता है कि सर मेरे को गुस्सा ही नहीं आता है, चांसेस तो बहुत कम है, तो एक रूब्रिक आपको मैं बता देता हूं। इसके पहले भी एक रूब्रिक डॉक्टर वसीम मैंने बताया था, आप लिख लीजिए ये। एंगर और इमोशंस कंट्रोल्ड बाय द इंटेलेक्ट। एंगर क्या है कि इमोशन है। एक रूब्रिक है हमारे पास, इमोशंस कंट्रोल्ड बाय द इंटेलेक्ट। बहुत ही अच्छा सवाल और बहुत ही अच्छा जवाब। इमोशंस मतलब एक इमोशन है जिसको हमने कंट्रोल कर रखा हमारे दिमाग से। 3 रेमेडी बहुत इंपॉर्टेंट है डॉक्टर वसीम। 3 रेमेडीज वेरी वेरी इंपॉर्टेंट। फर्स्ट इज प्लम्बम मेटालिकम, सेकंड इज वेलेरियाना एंड थर्ड इज वियोला ओडोरोटा। अगर आपने मेरा लेक्चर सीरीज जो पेड लेक्चर सीरीज में लेता हूँ गूगल मीट और जूम पे, इस पे मैंने केस डिस्कस किया था वियोला ओडोरोटा का। अगर आप मेरा मीटिंग अटेंड किया होगा, पेड था वेबिनार, तो आपको मैंने वियोला ओडोरोटा वहाँ पे पढ़ाया है। एंड ये रूब्रिक से एंटर किया हमने, इमोशंस कंट्रोल्ड बाय द इंटेलेक्ट। दिस वी एंटर्ड द केस। डॉक्टर प्राची, डॉक्टर प्रविंदर, डॉक्टर वेलकम। वीडियो सर के चैनल पर अपलोड होता है। ओके डॉक्टर शैरन, थैंक यू। सो दिस इज वेरी वेरी इंपॉर्टेंट टू अंडरस्टैंड, यू नो, emotions need to be controlled. Yeah, Violodora, Dr. Bilwalkar, if you have attended my, I think, Google Meet or Zoom meeting, paid ones, I discussed Violodora, you know, and I had cured a case of coronary artery block also with a simple remedy, Violodora. That's what I always tell you. Aphorism number 6, unprejudiced observer, even in case taking, even in mathematica, and you will get fantastic results. Vilodorata. I hope Dr. Wasim, you understood that. या अभी देखिए, आपको थोड़ा डिफ्रेंशिएट करना पड़ेगा डॉक्टर साहब। कार्सिनोसिन के अंदर रूब्रिक आपको लेना है, तो जो मेरा बहुत इंपॉर्टेंट रूब्रिक है, मैं देखता हूँ कार्सिनोसिन में, इट इज एलिमेंट्स फ्रॉम डोमिनेंस, कार्सिनोसिन, फॉलिकुलिनम, सीपिया, लैकोपोडियम. But here we are talking about emotions controlled by the intellect. Then the remedy changes. SMS 4, welcome. Sir, anger as soon as he wakes up from bed. Please complete it. Okay. अच्छा, आपके पास पेशेंट है क्या ऐसा, या आप ऐसे है? बड़ा मजा आता होम्योपैथी का, इट्स अ वे ऑफ लाइफ, यू नो, दैट्स व्हाट इज सो इंपॉर्टेंट, यू नो, टू अंडरस्टैंड दैट विच रेमेडी कम्स व्हेन, यू नो. लिख लीजिए, सबसे पहले आँख खोला, सवेरे हुई कि सबको डांटना चालू। डॉक्टर साहब मैं आता हूँ, उठता हूँ, सबको आई स्कोल्ड एवरीबडी, आई एम वेरी हैप्पी। प्लीज थिंक अबाउट कालिकार, प्लीज थिंक अबाउट कैंथरिस, प्लीज थिंक अबाउट कार्बो एनिमलिस, एंड प्लीज थिंक अबाउट पेट्रोलियम. In fact, last Thursday when I did a lecture, I think before that Thursday on, I think the date was 2nd of November, which I did my Zoom live, paid Zoom live. I discussed carbo animalis. In that case, it was a case of infertility. We cured it by carbo animalis. Beautiful case, not because I have presented it, but because I know that while treating that case with carbo animalis, I entered the case carbo animalis with a different aspect only, you know. So think about Dr. Paul Sangma, Kalicarb, Cantharis, Carbo animalis, petroleum. There might be more drugs also, but these 4-5 remedies I have found very useful in my practice. You know, this is the importance of understanding simple, you know, emotions of the patient, simple rubrications. Just define that, just see the modality and prescribe. You know, before Corona, I hardly had students because I felt that everything is taught in the college. But when I started allowing the students to join me, so I had 1 student, now I have 4, 5, 6 students working with me, and it is so beautiful, you know, interacting with them and interacting in my webinars and Google Meet, because mathematics is such a life subject. You know, you can have symptoms any part of the day, any part of the night. It is that interesting, Mater Medica. So entering the rubric or entering a case by a bird's eye view is very, very important, and you'll be surprised that some remedies which you never thought about, like cantharis, can be prescribed in these type of symptoms and these type of Mater Medica. Okay. So I hope you got that answer, everybody, and it's already half an hour up. I hope you understood what I wanted to tell you today, and I'm taking live, cases demonstration on Zoom, on Google Meet. So if you get time, join this. Of course, those are paid. Money is not a problem, but we basically want fewer crowd so that I can discuss my cases. So like November series is going on. 2 lectures have already been finished, done. You can check the details from my Facebook and always join in, because every time I take something on YouTube and people tell me, sir, हमको तो पता ही नहीं, we never knew. That's why I'm telling you, you can see my events on my Facebook and you can always join. So thank you everybody again, once again, happy Diwali to you and your family. Thank you once again. I hope you enjoyed as much as I enjoyed sharing my knowledge with you. Thank you so much. Until next Saturday, we meet again on Insta and YouTube Live.